Thank you for joining our presentation today on dissociative identity disorder. My name is Hussien Elkholy. I am an associate professor of psychiatry in Ain Shams University. Before I start, I have no conflicts of interest to declare. And first, I would like to discuss with you and tell you why we have chosen dissociative identity disorder to be the theme of our session. First of all, it's a controversial disorder. Although it has been recognized by diagnostic systems, still many experts do not feel that it's a real disorder or it could be explained by other disorders, especially when it comes to something like possession and pathological possession disorder. The second point is it's rare. I have seen a few cases through my career, and I remember that every case we've seen, we had always discussed the diagnosis and argued whether it was a real case of dissociative identity disorder or it was simply psychosis or it was part of a grandiose delusion in bipolar disorder and so on. So it has always been difficult to reach the proper diagnosis, and I don't think we have seen many cases of true dissociative identity disorder. And I don't think this is a situation only for myself. I think many doctors at different levels of their career have the same issue, like little experience with cases with DID. The other interesting point, which we are not going to discuss much today, but I hope this session will provoke further discussion about the diagnosis and related issues, is capacity and legal responsibilities. Are patients with dissociative identity disorder to be held responsible, especially in the eyes of the law? And also management issues. There is no clear consensus on how to manage patients with dissociative identity disorder. It depends on the underlying reason. Many argue that it's related to traumatic experiences, so maybe treatment should be directed toward that, and so on. The history of DID goes back to very, very early ages. Some suggest that there is some evidence in images of shamans changing into animal forms or embodying spirits in Paleolithic cave paintings. And throughout history, there were documentations and reports of demonic possessions in different cultures. In pharaonic times, many of the medical knowledge we take for granted now were documented in some of the papyri. I am going to especially highlight the Kahun papyrus, which discussed hysteria. And hysteria was considered by ancient Egyptians to be due to movement of the uterus, and that movement led to hysterical reactions, or what we knew later as convergent disorders, especially that most of the cases were females. They thought it was related to that, and they described it even before Hippocrates described it and built on the diagnosis of hysteria. And these might be one of the earliest description of hysterical or dissociative and conversion disorders using the old terminologies. As for DID, early records go back early to 1646. Some consider the exchanged personality documentations by Eberhard Gimlin to be the earliest documentations, but there were some documentations by Paracelsus, 1646, about a woman who had amnesia about an alternate personality who she believed to have stolen her money. Then Eberhard described this lady who had two personalities, a French lady and a German lady, and she could alternate between them. Then Benjamin Rush, who is considered the father of psychiatry, American psychiatry, theorized that the cause for the doubling of consciousness was a disconnection between the two hemispheres of the brain. In 1816, Dr. Mitchell published reports about the case of Mary Reynolds. That lady, at the age of 19, suddenly became blind and deaf for a few weeks. And then she woke up one day, forgetting everything that she had learned in the past, and started learning everything from the start. And then she slept and woke up again after a few weeks. After a few weeks she slept, and when she woke up, she regained her previous personality. She returned to her prior self, and she kept alternating between the two personalities for several years from that point. Pierre Janet, in the late 19th century and early 20th century, described several cases of multiple personality disorders. Many reports had been documented through history, and if you look them up, you'll find many stories about DID. In 1980, the DSM-3 considered these reports and created a separate category for dissociative disorder and set forth the criteria for the diagnosis of DID. But back then, it was called multiple personality disorder until 1994, where the disorder was when the disorder was renamed into dissociative identity disorder. I'm not going to talk more about diagnosis because my colleagues, Dr. Ryrie, will discuss further the point I mentioned earlier about how doctors at different levels find the diagnosis to be a bit challenging, and might highlight more on the diagnostic criteria. And I believe Dr. Wilson will cover also the topic from a very interesting point of view, like in old age and different age and other perspectives. So I'll move on to the main theme of my presentation: DID in literature and media. One of the earliest books was a novel in 1954 called The Bird's Nest, discussing a lady with multiple personality disorder. And 3 years later, another novel was published called The Three Faces of Eve, which is much more famous than The Bird's Nest. And both of them were turned into films later on. And discussing films, so as I've just mentioned, The Three Faces of Eve is considered one of the earliest and most famous films discussing DID. Many films cover that topic. One of the famous pieces of literature, which has been also made into films in different ages and different scenarios, with the Dr. Jekyll and Mr. Hyde. Despite that it does not describe a very straightforward case of DID, the idea of being able to move from one personality to an alter personality was very obvious in Dr. Jekyll and Mr. Hyde. And some movies or films cover the topic exactly like the novel, but the famous ones are more towards comedy. I remember loving watching The Nutty Professor by Jerry Lewis as a child, and later, I wouldn't say more recently, it was a while ago as well, Eddie Murphy remade the film into another film series, which was also brilliant, and both of them were funny. and were based on Dr. Jekyll and Mr. Hyde as well. Numerous films covered the topic. Some of them are very famous. I think most of us are familiar with Fight Club. It was a brilliant film, and the main character in the film was like moved between two personalities. One of them was very strong and established the Fight Club, and they didn't even realize that they are the same person. Jim Carrey did the same in Me, Myself, and Irene, another good comedy, although it did not describe DID in a very accurate way, and it showed that like the two personalities were very distinct from each other, which can sometimes be not be the actual thing in reality. A few years ago, Split was a major hit. Many were talking about it. I remember I haven't watched it at that time, although everyone was saying, like, as a psychiatrist, you need to watch that film. Although at the end, I don't want to spoil the film for those who haven't seen it, but at the end, he didn't have the ID. But the first part of the film like described the idea in a very good way. Many other films covered the topic, as I mentioned, and I can't cover all of them in my presentation, but some of them were really, really interesting. The reason I added this series to my presentation, I know that superhero series and stuff are not everyone's cup of tea, but in Doom's Patrol, that lady in the back was called Jane, and the writers managed to create this very interesting personality. She had, I think 60 something different personalities who were living in her subconscious in a place that was called the underworld or something like that, as if she had a basement of personalities hidden deep inside. And those different personalities had different superpowers, and they used to come out whenever they are needed, or sometimes they just emerged and caused chaos. Interestingly, I have seen a case, and when I've seen that case, I immediately remembered the series of this young lady who had been traumatized as a child, and Jane in the series has also been traumatized as a child. So this lady, when she gets really stressed, she just regresses to a different personality, a child form, a childish one. Sometimes she moves to another personality who was an adolescent, and other times she is her normal self and acts within her normal age. And that lady was admitted because she was really stressed, and she regressed back to one of those personalities. And after she was admitted, her partner provided a map. That map was created as if it was her life map, and in the map they mentioned places, good memories from her childhood and growing up, but that they were trying to anchor her to some real things. And they mentioned that every time that happened, that she could come out of it by following that map. As professionals, we were a bit skeptical, and we didn't know whether this was the right way or not. We were worried about the type of the relationship between them. But this is one of the other reasons we as a group felt that the idea is very interesting, and some people respond to other ways rather than what we all know. If we move to the Egyptian media, I also remember as a child enjoying watching Afrit Morati, Although, again, there was always a trigger that she would open the window and see that a new film is out in the cinema and she starts acting like the character in the film. It was also a form of DID. And one of the brilliant films in Egyptian media, written by Hassan Abdul Quddus, was Be'r al-Harman. I guess those were the most famous ones, but there are others. I hope in the discussion, if someone remembers something, we can bring those up for further discussion. And although I know it's not the ID, the reason I added Kida Rida to the list is if you've watched this film, in the beginning, the way he was describing his situation to the therapist, it felt like he was describing DID. He was talking about three alter egos, alter personalities who could do different things, and the two others were stronger than him, smarter than him. They did not fear anything, and he was a bit timid and couldn't do things he wanted to do, and this is why he was seeking help. Though the film was a comedy about the three being three actual brothers, but the way it was described was very interesting. And also highlights how therapists and doctors can be confused when someone is describing something like that. In conclusion, DID has been covered in literature and media in many, many films and many novels. However, it was not accurately depicted in many of them, which of course might have played a role in adding more mystery to the disorder and affecting the views of the public and some of the experts who would be affected by the magic of the silver screen and gather the information from media. And thus, DID remains a bit controversial for many of us. I hope we'll have some time at the end of the session to discuss your points of view further. If you have something more to share with us about other films or novels or some reading materials about the topic, we are not aiming to educate you about DID today. We are just aiming to stimulate the discussion about this controversial disorder. Thank you, and I hope you will enjoy my colleagues' presentations as well. Thank you.